Namaskaram to all of you. Namaskaram to my Guru, Sangeeta Kalacharya, Neelambari. It's very difficult to imagine a group like this without her. But I'm so happy that we continue to, meet and share, and it's her blessings which is carrying us forward. Shri Gurubhyo Namaha. I'm very happy to be sharing today with you as whatever little that I know on voice culture, care and hygiene. And I'm not a therapist, so disclaimer, I want to put right in the beginning itself. I am a student of music, and whatever I have gained today is actually out of, experience, yes, but because of discomfort. I learned it the hard way. So I used to have asthma as a child, and my mother put me to violin learning because she thought I could never sing. And I had chronic rhinitis. So whatever it was because, like you say, if you see Rajasthan, because they have water shortage, they have one of the best water management systems today. They learned it like that. So, somewhat like that. I had to put in a lot of effort, meet people, and go for therapy. I did practice yoga. I am also a student of Alexander technique. So, I learned that, and so I would like to share with you some of the do's and don'ts. Which there are a lot of myths in Carnatic music. Right from sadhana, practicing, how to practice. So the first thing they will say, start off with 3 kalam, speed, varna. There is no warm-up. It's like running a marathon without having any warm-up. So how are we going to do that today? We'll learn a few things about these myths that we have in Carnatic music. And if you look into all the kinds of vocal exercises that are there today on the internet, if you see YouTube, they're mostly Western vocal coaches. hardly anybody from Carnatic music. You might find some from Hindustani background. At least they are a little more aware of how to use the voice, how to maintain the voice. But Carnatic music, unfortunately, we don't know, or probably those who know have not thought of putting it out there. So I thought this is something I would like to share with you. So I'll start off with a small kriti, which all of you are very familiar with. Nabhi Ritkantha Rasana Nabhi Ritkantha Rasana Nabhi Ritkantha Rasana Nasadul Yendo Nabhi Ritkantha Rasana Nasadul Yendo Sasa Padi Sani Pamagani Pamagari Sani Sasa Maga Pamani Pa Sani Gari Sani Sakama Pani Sasa Pasani Pamani Mani Pamaga Mapa Sapamagari Sasa Magari Sasani Pamamagari Sasagama Pani Sasani Pamamagari Sasani Pani Sagari Magari Sapamani Pamagari Sasani Pamagari Sani Pani Gama Pani Sa Ripani Sani Sagari Samagari Sani Pani Sagari Samagari Samani Mapa Sani Pam Isagari Sagama Pani Shobilu Sata Swara Sundarula Bhajim Pale Manasa Shobilu Sata Swara Nabhi Hritkantha Rasana Nasadula. So here in this kriti Tyagaraja says, O mind, praise the divine forms of the 7 musical notes which glow in the navel, nabhi, heart, neck, tongue and nose. Now, if you look at this beautiful verse, nabhi, the sound has to come from the nabhi. Hrid, chest, kantha, rasana. Rasana is the tongue, and na. So it has to. Nasadula is the nasal, the nose. So now he was aware of these things. How was that sound coming? Where is it coming from? He was a Nada yogi. There are so many of his kritis which are just about Nada. So in this very kriti he talks about how all these various parts are involved in the vocal production. So now we will see how the voice is actually produced. Most of you probably know all these things, and in front of doctors I would if I'm wrong somewhere you can please correct me. So now phonation is the way the voice is produced, the process of voice production. Now somewhere here, now men have the Adam's apple, we can also feel it here. You just put your fingers here, the first bump that you get, that is the Adam's apple for women, but we don't say maybe Eve's apple. So, and behind that you will have, you can find the voice box. And the voice box, in the voice box you have the vocal cords, which have several layers. Anyway, it's basically muscles, like, rubber bands, 2 rubber bands. Now when you would have, all of you played with rubber bands as children. So when you put it on a box and stretch it on an empty box and just pluck it, you will get the sound. Right? This is very much like that. There is no plucking, but just the air is pushing it from the exhalation that we do. So when the air passes on that, it vibrates. Now when the pitch is very high, it's like having the rubber band taut, yeah? And it is longer, so the vocal cords will be longer and they'll vibrate faster, and when it is loose, it will be at the lower pitch. So now some of the things, that's why maybe some of us find it very hard to sing at the higher pitch. So we can just understand a little how this works. Now, basically, so this is our instrument and we have to maintain it, take care of it. This is how we are going to play our music. Right? Now, so we said that, we are getting the air outside, which is coming from the lungs, exhalation. And so we have to take in air and breathe out. While we are breathing out and we are producing the sound, this vocal cords vibrate. Now, we usually run out of breath while we are singing sometimes. So, can we just, best thing would be to, take in lots of air, store it somewhere, like filling your car with petrol, and then just keep going and keep going and keep going. Unfortunately, we can't do that. We can't, just have it all at one place. We have to keep taking in breath and leaving it. It will be very nice. We all had voices like Bhimsen Joshi. I believe his lungs used to expand to 8 inches when he inhaled. That the doctor has measured. I'm not, this was from his biography, I'm quoting from that. So, extraordinary lung capacity he had. Now, what do we do? Normal, human beings like us. So, how do we use this air that we have inhaled? While singing, we can't do that. So, whatever we have, we need to use it efficiently. That's the only thing that we can do. So, now the first thing that we have to do is about breathing using the diaphragm. So, diaphragm is the muscle here. Now, lungs we need to fill with air, but unfortunately it is stuck inside a rib cage. So now only thing is, if when we use while inhaling, right, the diaphragm will be flat like this, and when you exhale, it gets arched like this and pushing the air out of the lungs. Now you can imagine a harmonium, bellows that we all must have seen. Now when you press that, the air or the sound is coming out, right? Like that, when you are pressing the diaphragm, when you are letting it go up, more sound can come out. So now what we usually do is we are just breathing shallow breaths, normal breaths. While sitting, we are just doing it. Now if I say take a deep breath, immediately shoulders will go up, chest, and then we do this, right? So none of this will work while singing. So the practicing diaphragmatic breathing is the first step to breathe well. So you can do a small exercise with me. Just hold your abdomen, put your hand on that. Take a deep breath. This is like a balloon, okay? You can see. Now the chest is not going to go forward. As you inhale, this has to come up, your abdomen, and when you exhale, it has to go out, go in. Let's try that. Inhale. Chest should be normal. Don't raise it. Exhale. Once again, inhale. Don't raise your shoulders. Keep your shoulders relaxed. Neck relaxed. Again, exhale. Inhale. Now we are going to do a small exercise. As we exhale the next time, we're going to say ah. Which would you like? G is okay? G is good. Is some hum बचता है. Once again, put your hand on the abdomen. Let's inhale. Again, fill it. Just keep your hand there, it will fill automatically. Exhale again. So, deep breathing is actually using your diaphragm. It is diaphragm supported breathing. We are not actually breathing with the diaphragm. Practice this. Now pick up after them, okay? Pick up after them. Yeah. Okay. Now, as when you're sitting somewhere, you can just practice this deep breathing through the diaphragm. It becomes a habit, and the next we'll do. Now, as we say ah, we are going to pause. Okay? Now I'll show once. I'll take a breath. So I'm using my diaphragm to push the air out, so you will get the pause. That is to establish a connection between your diaphragm and your throat, your voice. We'll do it once again. Okay. Next exercise. Take a deep breath. Just don't do that. Just say shh and leave the air out. Okay, once again. And immediately it will fill up. You don't even have to try. The minute you say shh and the air from your lungs go out, it's going to get filled again. Now those who have practiced Kapalabhati, you might be aware of it. You are forcefully inhaling, exhaling, and immediately you breathe. So now again, when you do Kapalabhati, it strengthens your muscles and your diaphragm and it clears everything, right? What do we do? Ujjayi also, if anyone has practiced Ujjayi breathing, that helps clean everything. All the phlegm will clear out if you do Ujjayi. So from here, now you have your rubber band in a small box, okay, and you just strum it or you pluck it and the sound is produced. But that is so small, the sound is very small. Now in an instrument, if you take a tanpura or a veena or a violin or whatever, guitar, there is a chamber, resonating chamber, through which the sound needs to go so that it gets amplified. So now where is the sound going to come after it is being produced by the vocal cords? Where does it go? Anybody? Head. Okay. Also here. Sinuses. Yes. The nasal cavity. Now these are like two resonators that we have here. Okay. And we need to learn to use them for actually amplifying the sound. What we do usually is push everything from the throat. Okay? So when you go to higher notes, it cracks. That's one of the main reasons, because we are not using these areas. The chest also we use. Chest, you know that when it's a low pitch, your chest vibrates, it resonates. So the chest can be used effectively, the nasal cavities, and so if you have a cold, that's why you have the sound ball is not so nice to hear, right? It's a stuffy kind of sound, muffled sound that you have. Now we will do some exercises so that we produce the sound from our nose. Okay? Now these are things that I learned from All India Institute of Speech and Hearing. So after one recording, I completely lost my voice. It started hurting so badly. I couldn't, the minute I start singing, it would pain and then I would feel extremely tired. And in speech and hearing, they usually keep doing a lot of research and they look for artists, for collecting their data. So they keep giving us questionnaires and for hearing sometimes. So there were some very interesting studies, like once they said violinists, I believe, can cut out all the noise. They're trained, their ears are trained to cut out all noise and only look at what is the appropriate sound that they need to catch. So these are, things which we even never imagined. So when they gave me this questionnaire, I realized that some of the symptoms that they were asking, I was having all those symptoms. So that's when I went for therapy. And 15 days therapy helped a lot, tremendous improvement in my voice. So now we will do this small exercise. We are going to do like small children. That's called a literal. You can try, do it with me, no problem. Okay, so even before you're going to the concert and sitting in the car, you can bug your spouse doing this exercise, and then you'll be very relaxed actually. And then you can also do a literal. Okay, this is another one. So these are for relaxation. And then we are going to do the simple exercise. I'll do it first, then you can repeat after me. Feel the vibration here. not just from the mouth. You should feel it coming from the nose. You're actually pushing the sound. So they call it as placement. Where are you going to place your voice? Okay? Are you placing it low, or are you placing it in through the nose or the head? So chest voice, head voice, they have all those things. Okay? We'll do that shortly. So then, we also do this loud and soft. I'll do it once, then you can repeat after me.
How do I get it really from the nose?
It's just the same mo, mo, mo. Mo. Okay, let's do this. Now I am talking to you normally, right? I can also talk through my nose. I can talk to you like this, no? I can also use my nose to bring out my voice. So where are you going to bring out the voice? Right? Or I can bring it without mixing any nasal sound, and I can bring it from a deep voice like this. So how do you bring out your voice? Where do you place your voice? You can place it in my chest and have a no mix at all. Or I can mix the nasal and, or I can talk only through my nose like this. So this is how. Okay, so this is what we are going to do. We are doing the mo. So I'm using the nose, the nostrils, my entire cavity. This mostly it's whole. It's just space, empty space, sinuses. That's why if you have a sinus infection, it's all going to get filled, right? Because those empty spaces will help to resonate. Chambers will resonate the sound. Okay. Is that sound? Now we'll do loud and soft. Once again. Soft to loud. Like that. You repeat it every day for several times. They have those numbers. This is just a kind of a, just to give and talak, little bit of awareness through these exercises, which will help you.
Any specific repetitions to be done? Any numbers?
That's what I am not a therapist actually. So
what is the time duration that we need to do this?
It's about 10 times we do, and then there are variations. They take you through a whole process. So what they did was we started with mo, and then with pa sound, and then they make you read all the words with ma in it, and you're trying to bring out the resonance more as you speak. So you will start applying it into your speaking voice and then eventually into singing. So they take you through a process. It's not like one day you can't master it. Practice actually. So it takes a lot of load off your throat when you're singing. So especially now, that's another thing that we do. When we have a program or something that new that we have to learn, practice until your voice tears, right? So now, how can we do it in a way that this voice has to sustain? Finally it's like an instrument. You have to take care of it like a baby. You have to take care of it. So that is what we have to do. Warm up. Alright, I'll talk about it eventually. Now, number 3 in this. So we saw firstly how to breathe, how we can use the air that we all exhale effectively, efficiently by using the diaphragm to help us in breathing. Secondly, where to place your voice. Now, in Carnatic music, we don't appreciate a false voice. Whereas in, if it is a Sugam Sangita, they have no problem. Film music, no problem. Even in Western music, operatic singing, they use that's what is head voice. So we'll do a small exercise. Now let us see how we are going to use the voice. I need to use this thing here. The Pugalala. Pugalala. I am starting with G. Half an octave. Chest voice, yes. Some people sing only from the mouth without even opening their mouth. That is also children, especially when they are still learning how to sing. Most of you must be having students and you know what are all the things that they do, right? So now this is the difference between the chest voice. You can still go down. Now you can find out with the correct pitch for your singing. If you can easily go to the mandala pa, if you can do that much, that is your appropriate pitch for singing. Now if you go to speech and hearing, they will test and tell you whether you are using the correct pitch for speaking, correct pitch for singing. So this was again, for me a discovery. I used to sing at F sharp and F sharp, and I thought I could never go higher. So they said you're using the wrong pitch. Your pitch is much higher, and so that's when I shifted to G sharp. So yeah. Now some of these things, it really helps when you take some expert advice. Okay. Now pitch and range. Most of us have a 2-octave range. That is 1 octave, half octave higher and half octave to the lower. Now if you feel I'm not able to go to the higher octaves at all, how do I improve my range? Okay, that might be one of the questions. Now if you want to go higher, you have to be able to go lower and practice lower at. That is what Parveen Sultana and all say. Okay, so we will do, now my pitch is G sharp, This was the higher G sharp. So this is A. Sa. This is my pitch, usual pitch. Now, if I want to practice the lower octaves, I have to take at least one octave higher, not half, but one to mane. So I will keep A sharp.
Not half.
Half along, one, yeah. Okay. In sa. We can do this. So I'm going sa, ni, da, da, ba, ma, going like that. You don't have to look down. We think we have to do this to go to the lower octave. You don't have to. Keep the neck very, very relaxed. Okay, neck muscles must be relaxed. Shoulder relaxed. Now, the lower VDT, ma or ga you can go, but it's not that you cannot go after that. Range can be improved with practice. So when you are practicing for the lower notes and you are not able to get any sound out, try to do this exercise like blowing off a candle. Exert. Sound will come. First time. Keep doing, it will come. So, in last week's concert, Thursday, T.M. Krishna happily went till song. That was so good. Okay, so you can achieve it with sadhana. Now, having talked about
But you kept it at A sharp.
A sharp, is for you to, when you want to go lower, you practice with a higher pitch.
So you will go down.
You can, it feels very normal for the voice. Easily you can do it. Then eventually you can start with your own pitch. This is only for sadhana, for war not. Okay? If you do this in the morning, on an empty stomach, one Kapalabhati round, and do this, you're done. You can do anything the rest of the day.
So we don't have to do similar exercise for the higher,
No.
lower ones.
Control is all that you need. Now, the next thing that I will come back to my pitch here. Because that will be uncomfortable with it. Now, usually, even sa pasa hadingle maklu dasa japa dasa kepadavi. So try to go to the point. Three point you learn on it. Straight. Yeah. So try to do that. Now we'll do a small exercise for glides. How we can use our voice, because we are not only going to be doing sa-pa-sa all the time, we need to be doing much more than that. So one exercise that we'll do now, which we can call as like a swing. I'll do once, then you can also do. So now imagine the sa and pa are 2 points, but you are not connecting them as a straight line. You are connecting them like a curve. Like how a swing will go, like that your voice has to move like that. It's not right, okay? It's not a straight line that you are connecting. In your head you think of it as a curve, nice curve. Once again. Okay, next one. Swing or a pendulum, you can imagine this. Then, so the curve and the flow is very important. How you are connecting the notes. We'll do another exercise. In which ragam would you like? Shankaravana? Shankaravana? Okay. Sarigama padani sa zirava magarisa. for that day. So you did Latangi today. Sarigama Padanisa. Sarigama Padanisa. Rigama Padanisa is also important. Because the voice from Ga, it's again a new position for the voice. So from there to take off, so that you can do from sa to sa, re to re, ga to ga, like that. Sari gari sa, sari ga ma gari sa, sari ga ma pa ma gari sa. So in the higher octaves, the higher notes, we will be using something what they call as a mixed voice, which is somewhat from the head and somewhat from the chest. Okay, we can't define it. So when you hear, maybe when I went to that's a mixed voice that I'm using there. It's not a chest voice that I'm using. Okay, strain illa haduvodu.
When you say mixed voice, it's a false voice.
It is not fully false also. It's not false at all, but they call it as a mixed voice. It comes with practice.
It's more easy.
Yeah, but it's somewhere from the head. Higher notes you need to place it in the head. So that is how it is. Okay, now so in Carnatic music, when we are doing these exercises, we also need to practice the gamakas. So which is the note where you are going to give the gamaka? You can't give gamaka to all the notes, and you can't sing them totally flat also, right? So which notes when we need to give gamaka, you need to pay little attention to that. Sari ga ma pa da ni sa ni da ma ga re sa. So ga we are giving a push. Practice with that. Won't sound effective. So you need to practice with the push. Okay, this is another thing. And then when we are talking about ragas like Shankaravarna, Kalyani, so now the students will be saying Dani. It's not going to me at all. Dani, sa, da, sa. It's going actually to sa. Right? Sa, mi, sa, ni. So you have to practice that. That sa is not sa, ni, Allah. Sa, ni. It's from sa, it's falling into me like that. So where are the notes falling? So little bit of conscious practice. ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡೋವಾಗಲೇ ಈ ಒಂದು ನ್ಯೂಯನ್ಸಸ್ ಕಡೆ ಗಮನ ಹಾಕೋದು. ಸರಿ ಮ ಪದ ಸ ದ ಮ ಮ ರೇ ಸ ಸಿ ದ ಮ ಮ ರೇ ಸಿ ದ ಮ ಮ ಗ ರೇ ಮ ಗ ಬರೋದೇ ಇಲ್ಲ ಇನ್ ಆರದು. ಗ ವಿಲ್ ನೆವರ್ ಬಿ ಎಕ್ಸ್ಪೋಸ್ಡ್. ಮ ಗ ರೇ ನ ಆ ಆ ಆ ಮರಿ. Whereas if you sing Dilahari, Sari Ga Ma Da Sari Ga Ma Ma Ga Re Sa Ga has to be exposed. So when you're practicing, those are the things you can also do when you're doing it. Because I can take it a little forward for Carnatic music when you're doing it. Sari Ga Dilahari. Especially the double gamaka is very, very effective for ragams like Dilahari, Arabi. So these are some of the tips for exercising.
Just now, you put your tongue up.
So about the tongue. Yes, everything so the tongue is used for, Mama used to say that very beautifully. Ella alapana pandroche full verum aan udakudadu. You know, there is na, there is ra, there is some yeah. All those sounds, vocalization, you know, she was very good at that. And Mommy's voice was, you know, shining forever. Like even at her age, she never a single day Shruti Kola, crack or, you know, she never had those things, issues at all, because she was mastery. Shruti, I think, pitch she reduced a bit, that's all. She used to sing at higher pitch. But not in a concert, she would never lose her Shruti. That's what I'm saying.
What I'm saying is, she overcame that problem. In the 50s, she had a small problem.
Yeah.
Everything. Double education. But she overcame
it. So now going to the voice scale. Quickly, I think I have about 5 minutes. So now another thing about our voice is what we think while we singing, what we feel, our emotions. Now my voice is not good. You know, if you keep doing that self-talk, it's going to be very difficult to sing. So one of my teachers used to say, "Nan thara yaru hadalla ankobeku." Mom used to say that. Okay. Sukanya madam used to say that. Yeah. So that self-talk is very, very important. So now when we all have a concept of how our voice should be when we sing. You know, like some people like it to be very sweet, and some people think, you know, it has to be very, very mature sounding, more mature than their age, you know, like for their age they'll be singing Kadavatana, somebody used to say. I'm like, you know, sounding like an old person. That kind of thing, or no, give too much of vibrato while singing. So these are things that they believe that my voice should sound like this. So now we all have that, but don't beat yourself up. Even if something goes wrong, it's okay. It's okay. You should just move forward. And that self-talk, you know, it's very nice, and it's so you have to, when people are listening to you, all this homework they should not hear. That should be at the background. At home you should have finished all this exercise and you know, anxiety to perform. We all go through that. Especially, so whenever you're feeling that anxiety, 2 things that you can think of. One is, tell yourself, everyone goes through this. It's not only happening to you. Secondly, you are not going to pay attention to the listener. Who is listening? Who has come there? No. That is not your job. Whether am I sounding good or not, they will find out. Even competition, I told my students, did I sing? Did this person sing better than me? That person, that is a judge's job, not your job. Your job is to just sing properly. Just focus on your work. That's it. And third thing, take a deep breath. So we forget to breathe when we are anxious. So breathe nicely. You're still sitting in the green room. Take long deep breaths and then your emotions will calm down. And sing happily. And so now the next thing is articulation. When you're doing this Akara Sadhana, you can also do E, A, O, U, right? Oh, we need to push there. If you don't give that blast there, sweet, perfect Shruti, but it's not touching you at all. So these are the places when you need to emote also. Think what are you going to do? How are you going to touch that person? So that is very important. And A, lot of people do A instead of A. You need to, actually make it a very sweet. Telugu people do the A so nicely, and the language itself is like that. A, you listen to them. And recently there was one Manali Bose, I heard her on Facebook. Bandish, some 1,000 Bandish they are covering, I think. And she has sung a Bandish in Durga Raga. That articulation is so sweet. I'll share the link with you. A, O, U, everything is there and it's so sweet. And the voice is so beautiful. So those are things that we need to, pay attention to. Now when you listen to T.M. Krishna or Ranjani Gayatri, front focus. Sometimes Krishna sounds nasal actually, but he uses his nose so well. The sound will be loud and there will be open body gestures also. So another thing that we tend to do is when we are afraid, we tend to crouch. We want to hide and disappear from it. So that our shoulders will crouch, shrink. So try to keep it plain. So this is something that Alexander technique can help a lot. I've been learning now. There is a person called Padmini Menon in Bangalore. The Bangalore people are very lucky. You can just go to her, and she is an expert on this technique called Alexander technique, which tells you how to use your body efficiently. That's all. Relaxation. Okay, I'll just show one small thing. Now you can all practice. For just the sitting we will do. Okay. Now the minute we say sit straight, all do this or will arch the back unnecessarily. That is not sitting straight. When you are sitting here, we are actually now pay attention to your sit bones. You are sitting on a bone here, right? Just feel the bone. Let it carry our entire weight. Your shoulder doesn't have to do any work. Your hips don't have to do anything. Your back doesn't have to do anything. Just let go and put your weight on the bone. That's it. Okay? So now the next thing we are going to do is your neck needs to be relaxed. Relax your neck. Don't straighten, don't do something, just now. Okay. And what we are going to do next is the spine from your hip till the it's actually inside the skull. This spine goes inside, right? Your skull is just sitting like this on top of that, right? So it's long, not just till here, but more than that. So you just don't straighten, but think of elongating it. Don't do anything. Just give a direction, tell it to elongate. From the tip between your hip bones and into your head. Straighten, let it elongate nicely. Lean forward slightly because your spine is actually little bent. It's not straight like this. Okay, this is the natural curve that the spine has. You can lean forward little bit and feel your sit bones. And now, again, don't do it, but just think. Your shoulders expanding. Don't expand it actually, but just think of it. The back, you have two big bones, shoulder blades. Now imagine that they are nicely moving apart and your shoulders are flat, not raised. Now you continue to imagine, don't do anything, just keep thinking of length as well as widening. So how did you feel?
It's totally relaxed.
Yeah, this is, so they teach you how to sit, how to stand, how to walk from there. Because these are all habits. Whatever stress that we have, we carry it into our bodies. And the body tenses up and again it's a vicious cycle. So if you are interested, you can go and learn this technique from her. I went there for violin playing actually, to improve my posture and all that. But benefited a lot of other benefits also are there. So, this is a technique that a lot of physiotherapy people learn, physiotherapists. But in India, she's the only Alexander teacher. She's the only one. She's trained in UK. Okay. Now coming back to the exercises that we did, voice exercises. Now we will talk a little about how to care for the voice. Now, if you're going to have coffee before your singing or concert, that is a no. You should not have coffee. Now, caffeine is something which dries up your throat. Okay, so whenever you are singing and practicing also, when you're sitting for practice, every 20 minutes sip some water. Not cold, not burning hot also, can be warm, just normal temperature. So hydrating the voice is very important. Okay, and caffeine you should avoid. Avoid oily food, avoid spicy food. If you have too much spice, you can have that reflux, acid reflux, and it can really affect your voice. And a lot of people think having a lot of kashaya also is very good. Kashaya also will affect your voice because it's very spicy. It can affect your voice. Just water is enough. And break your practice sessions, 2 or 3. One session, just warm up. Do Akara Sadhana. So you can do one more exercise I just thought I'd share with you. As I learned in one workshop with Seshu Gopalan sir.
What is your take on straw formation?
Straw formation also you can do. I'll come to that. Alankarams, you can rearrange the alankarams from simplest to the longest. Sari sari gama, sari sari gama, sari ga sari gama, sari ga sari sari gama, sari ga ri sari gama, sari gama ga ri sari gama, sari ga ma, any speed, more and more speed. Sarigama, sarigama, 6, then 7, then 10, 14, 12, 14, and 14.
The question was on Akara. Some people say we have to intonate Akara. Where should the intonation of the Akara come from? From the throat? Or I've heard another very reputed music, ha children.
For practice, maybe. If you are not getting the sound, you should use ha. Otherwise, you don't need to. Only if it is very lower octaves, you need to do. That's all. Okay, straw formation is another exercise which you can try. You just have a glass of water, half fill it with water, and put a straw in it, and then blow into it and make bubbles. But while you are blowing out, just make sure the bubbles continuously stay there. So you are blowing evenly. So that is a nice exercise, straw
They
formation.
also say keep a candle and blow it just
Blow
enough.
that, yeah.
That it
So
doesn't go.
that is the thing. Most of the things you already know. I was wondering, what am I going to talk about? Because all the people here are a learned audience. Huh? So anyway, I hope whatever I have said has given you a little bit of thing. Now break the exercises into different schedules. If you're going to learn something new, a new song, 10 times, 100 times we need to learn it. Repeat. That's going to be very strenuous for the voice. So one of the things that I do is I just listen. Play it and listen till you become familiar. That, and then it will reduce. Muktayam, when you are practicing Muktayam, your voice will, lot of strain. So again, don't do everything at once. Don't practice for 2 hours like that. Okay, so voice care, rest is that is only voice hygiene, vocal hygiene. So like they say, brush your teeth, like that. So for voice, what are the things you should do, should not do, like that. Okay.
At work, we are having to talk a lot.
Correct.
So how can we balance between that strain and because
That,
we cannot avoid that. Even teachers,
yes,
they have to talk.
teachers, then, so they're, again, basically they call them professional voice users. Anyone who needs to continuously use the voice, sip some water now and then. So even when you're singing, now like suppose you're trying to practice alapna, then your thoughts flow will go. So sometimes you tend to go on and on 40 minutes. Try to take a break. 10 minutes, take a break. Rest. No problem, 5 minutes. Rest, don't do anything. Drink some water, continue. So you break it into different sessions. One only warm-up session. Then one for learning something new. Third session, maybe you can do the creative practice, where you just take a kriti, do your manodharma, swara, nirmal, and all that. That way you can protect your voice. So these are some of the things I wanted to share with you today. I hope I've been of some use to you.
Very useful, very useful.
Thank you very much.
I regret that we never used you all these days.
Yeah, I was wondering why we didn't have a session all these days.
No, actually, every Neelambari.
I know, credit to this organizing committee.
Yeah. Thank you so much for this wonderful opportunity.
There'll be
Share.
more,
Yeah.
don't worry. You have to do 2 days, 3 days.
Thank you.